This next test is to evaluate the lower chain, and we're looking at the calf muscles. In particular, we want the muscles that wrap around the bottom of the foot. They kind of form a sling. They come down the sides of the calves, cross underneath the foot, and they control the position of your foot. These muscles are called the peroneus and the tibialis posterior. They're your primary muscles that control the internal and external rolling action of your foot, or what we call supination and pronation. So to test the tibialis posterior muscle, that's this muscle right here, we tend to turn the foot out and then have her do calf raises with the foot turned out. And then to test the peroneals, we'll turn the foot in and do them the opposite way. And we want to get a full range of motion, so you want the heel to drop all the way down and all the way up. Not in rapid succession, but a nice, slow, steady movement that puts a load on the muscle and allows you to watch how well they can contract and relax the muscle. So go ahead and stand on your right leg, and up, and down, and up, and down, and up, and down. She's not showing any weakness. She's not changing her hip position. She's just going straight up and straight down. And you can see a nice smooth lifting of the gastrocnemius muscle and full participation in the lower chain of action. Now let's have you turn the heel out, and we'll do the same set of tests again. And up and down. A nice steady contraction. You just want to watch to see how well the calf muscle rolls up and down. The peroneus muscle wraps down and around the outer malleolus here and goes down the side of the foot, wraps underneath the foot. She's able to control her foot motion quite well. Good. Now this is a good lower chain muscle test. Let's go ahead and try the other leg. And good. And let's turn the hip a little forward. Good. So you want to keep those hips square while we're doing the test. What will happen is the person will tend to move in this plane here, and you're really only testing the gastrocnemius and soleus. By twisting in this direction here, you can put your hand on the person and go, man, that tibialis posterior is really working during the action. Okay, now we'll switch to the other side. And you can see the peroneus tendon is illustrated quite well here, and it wraps around this part of the foot, goes down and attaches here, crosses the bottom of the foot, and goes all the way over to the big toe. And she's doing quite well, no problems there. Good. One more test that we do on this is to put her in the runner's position and then test her overall stability. So we'll come back over here. So go in the runner's position again, and up on the toes. Good. Now this one here, the patient can put their hand on your shoulder, and we're going to reach down and just pull the heel out, and then reach and pull in. She's very stable. In a person who has weakness here, they'll wobble and start to fall down. We'll test that again, and resist, and resist. So her peroneus and tibialis muscles are working quite well. Let's turn around, Roxy, and we'll do the other one. Good. So they can see it from the other angle. And resist, and resist. Resist. There we go. Simple test for the lower chain. We've just now tested all of the muscles of the biomechanical chain of action involved in running. If you have any weakness in these muscles, you'll need to rehabilitate them before the runner goes on to the next phase of their training.